Hello, everyone. Thank you for joining today's webinar on the HAP Medicare Advantage Savings. My name is Christy Strauss, and I'm a broker sales manager at Insurance Advisors Direct. And we are pleased to have with us today Kevin Cox, the regional sector consultant with HAP, and he's presenting today. So just real quick before we kick this off, you are all muted. So when you should have a question, just type it in the chat box, and we'll address those questions at the very end. Also wanted to let you know that this webinar is being recorded, and it will be available in our YouTube library. I will contact you within a few days and provide you that link. It takes a few days to get it edited, and we'll send it out to you. I do urge you, though, to please subscribe to our YouTube channel. You'll get automatic updates that way. When we should file a new webinar, you'll get an email update on that, and perhaps it's something you'd like to listen to. But with that being said, I'm going to hand it over to Kevin Cox right now. And Kevin, thank you for doing this today. We're pleased to have you with us.
Great. Thank you, Christy. I first want to thank IAD for putting these webinars on. I know it's a challenging time for all of us going through the crisis that we're all dealing with right now. So it's a great time for us to kind of take a step back and try to come up with some ideas and things that we can present to you or to give you some refreshers. We will go over the individual Medicare Advantage plans and briefly the Medigap plans at a very high level. The goal of this presentation is really just to highlight some of the savings or the key benefits that we have built into our plans. So that way when you do get back out there, when you're meeting with your clients, you can remind them of these benefits to help them save money and to help you secure the sale. So as we move through here, a couple things that we're going to talk about is with HAP, most of you, if not all of you, know, is we do have a wide variety of options. So our product portfolio consists of HMO plans, HMO POS, and PPO products. So there's plenty of options for your clients to choose. More flexibility. So as a reminder, even though we have HMO products in HMO POS plans, on almost all of them, members are not required to get a referral to see a specialist, so they can self-refer to their specialty providers. There are a couple plans where we still do require the referral, and I'll remind you which one those are in just a few minutes. And then remember, we do have out-of-network coverage on all the products to some extent, and I'll show you that here on the next slide. More savings. So we're now into almost April, so we're at the end of March, and we as carriers and whoever, we all have access to the enrollment data through CMS because us as health plans have to report that every single month. So we pull that information and get competitor data to kind of see what's selling across our state. Michigan was the number 4 or 5 largest Medicare Advantage growth during AEP this year across the country. So we had a very good year here in the state of Michigan as far as Medicare Advantage growth. And the reason why I bring this to your attention is that when you take a look at what did sell in our state or what's continuing to sell throughout this year is well over 80%. I would say it's very close to 90% of the new enrollments into Medicare Advantage went into $0 premium plans. Of the other percentage that's remaining, it was into plans that were less than $30 a month. Not to say that there aren't people still buying those plans in the $70 range, the $100, the $190 range. It's just very far and few between. But when you look at the enrollment across the entire state with all of the carriers, most of the enrollment is going into $0 premium plans. And the nice thing with HAP is we offer not only a $0 HMO product, but we also offer a $0 PPO plan. And then as a reminder, built into our Medicare Advantage products, we have all of the extra benefits, the supplemental benefits that your client doesn't have to pay for, such as the dental, the vision, the hearing, the over-the-counter, and the gym membership. And we'll recap those really quickly for you so you can see who we partner with to offer those benefits and how your client can use them. So really quickly, I just want to touch briefly on our service area. So HAP for AEP, we were the third largest growth of all of the carriers across the state. Priority Health was number 1, and Humana was number 2. However, you have to take into consideration our service area. Those carriers can sell statewide, Humana has both Upper and Lower Peninsula. Priority Health has all of the Lower Peninsula. We only have a fraction of the state, and we were the third largest growing carrier here in the state of Michigan. So within our service area and within the area in which we can sell, we did very, very well. But I want to remind you what our service area consists of and how it kind of breaks out with hospitals and doctors. So for HAP, when you look at the core service area, which is the area that's highlighted in orange, the 30 counties, that's where most of our plans are available. However, we do have 2 plans that are available in the counties that are highlighted in the bright blue in West Michigan that are new for this year, and I'll talk about here in just a couple minutes. But in our core service area, just as a reminder, we have a very expansive network of doctors and hospitals. In fact, we have 100% of the hospitals in every single county they're highlighted in orange, with the exception to McLaren-Lansing. So the only hospital that we're missing within all those counties that are highlighted in orange is McLaren-Lansing. Keep in mind we have McLaren-Port Huron, McLaren-Macomb. All of those facilities are in network. It's just the Lansing Hospital that is not PAR. When you look at the providers, so both primary care and specialty doctors, you're looking at well over 90% of the doctors within that service area are in our network. So just know that when you're marketing and selling the HAP product in our service area, we have a very robust network of doctors and hospitals. When you look at the counties that are in blue, as a reminder, those are new for 2020. We expanded into West Michigan, so specifically Kent, Muskegon, Oceana, and Ottawa County. And we've partnered with the Affinia healthcare system over there, which is Mercy Health. And we did very, very well on that side of the state, specifically in Muskegon County. So if any of you on this webinar or anybody that does download this from the IED library and reviews this at a later date, if you're selling in Muskegon, or those surrounding counties there, take a look at the HAP product. It is a narrow network option. So as a reminder, it's a partnership with Mercy Health, but the benefits are super rich. And most of the people that are doctoring in Muskegon County are going to Mercy Health anyways, so they're very attracted to that product. And then as a reminder, if your client's traveling, whether it's outside of our service area in Michigan, or maybe they're going and traveling to other parts of the country or outside of our country, all of our plans have ER and urgent care benefits built into them. And we will cover our members at $50,000 a year for ER and urgent care internationally. And then as a reminder, ER and urgent care in the United States is always treated at the in-network benefit level, no matter where your client goes. So let's take a look. This will switch. Give me a second here. Yes, 1 second. At the out-of-network coverage. So I know that it might have went too far. 1 second. Let me go back one, guys. Got a little bit of a delay. See if it makes it. There we go. Okay. So I know you're seeing here in Michigan, you got the national players that are in the space, such as the Aetnas, the Humanas. You now are seeing WellCare enter in that purchased Meridian. And then you got some of the local players, such as ourselves, Priority Health, Blue Cross Blue Shield. So out-of-network coverage and national coverage is kind of becoming a hot topic and more an attractive thing. So I really want to highlight how our out-of-network coverage works for routine care, so things that your clients are choosing to go out of the service area for. So as a reminder, and we just talked about that on the last slide, is that ER and urgent care anywhere across the country with any provider that accepts traditional Medicare is always going to be covered at the in-network copay. So really where it comes to the point where you have to have these conversations with the client and compare it with other carriers is when it comes to routine care. So what if I want to have a follow-up visit with a primary care physician, or what if I choose to go and have a heart surgery at the Mayo Clinic? How am I going to be covered? That's really where this comes into play, is when a client is choosing to go outside of the service area to get routine type care or pre-scheduled care. So let's take a look at our HMO plans on how that would work. So with our HMO plans, or an HMO generally, typically clients don't get out-of-network coverage for anything outside of ER urgent care. However, with HAP products on our HMO platform plans, we have a travel benefit built in that gives your client access to routine care if they're in Arizona, Florida, Texas, or anywhere outside of our service area here in Michigan. So it's really designed for the snowbirds that typically maybe have summer home, or I should say homes, or they travel in the winter months to these states, to these warmer states. They can use the HMO benefit or the HMO coverage and pay the in-network copay. So if they're going to Florida, Arizona, Texas, or anywhere outside of our service area here in Michigan, and they want to have routine care, they can use the travel benefit and they would pay the in-network copay. There's two requirements to utilize this benefit. The first one is the client must see a provider who accepts traditional Medicare, and they must let HAP know ahead of time who they're going to see, so that way we can work with that provider and let them know how to bill HAP, and we will also share with the provider what their cost share would be for the services that they're trying to seek. Now, as a reminder, there are services, just like on any other carrier's plans, that do require prior authorizations. That's going to apply as well. Not to say that they can't get it, but if a benefit requires a prior authorization, whether they're in or out of network, that's always going to be required. Now let's take a look at the HMO POS benefit or plans. So with the HMO POS plans, what's different from the HMO plans is that these members have access to routine care outside of the network with any provider who accepts traditional Medicare across the entire country. So the HMO POS members aren't necessarily just limited to Florida, Arizona, or Texas, because what happens in the HMO POS plan is these members are using their point of service benefit when they're choosing to go outside of the network. And with HAP, you'll see on our plans, our POS products, is that we give them a certain dollar amount per benefit category to go outside of the network and get routine care. Typically, they're going to pay a little bit higher of a cost share to access that out-of-network benefit, but they do have the flexibility to do so. Now, with PPO products, it's pretty much standard across the board here, but same thing as with HMO POS members is the PPO members have access to see any provider who accepts traditional Medicare across the entire country for routine care. So if they're using their coverage for anything outside of ER urgent care and they're outside of the network, they can do so. It's going to fall on the out-of-network benefit level, and they'll pay the out-of-network deductible if there is one on the plan, and they'll pay the out-of-network co-insurance up to the out-of-pocket max. So the cost share for the beneficiary can typically be a little bit higher when they're using the out-of-network benefit level, but they have the flexibility to do so. You have to keep in mind a couple things too when these members are going outside of the network, whether it's HMO, HMO POS, or PPO, is that the reason we're requiring them to go to a Medicare approved provider, which is well over 98% of the doctors and hospitals across this country, is because we are only responsible for the Medicare assigned amount. That means our members can't be balance billed, and that means we can't be charged these excess high charges for these services. So to give you an example, and I'll move to the next slide so we can have a visual here. Let's take a look at the fourth plan here, the HMO or the HAP Senior Plus Option 1 PPO, the 011 plan. On this plan, you can see it has a $275 out-of-network deductible, and then it goes into a 70-30 co-insurance split up to $7,000. So let's say your client is on this plan and they want to have a follow-up visit with a specialty provider in Florida. They have the ability to do so. They would be responsible for the $275 deductible, and then after that, they pay 30% of the cost share. Now, it's 30% of the Medicare approved amount. So let's just use $100 is what the Medicare assignment is for a specialty doctor. If the member is in their co-insurance split, we would pay $70 for that visit. The member would pay $30 for that office visit. So you can see that it can be higher, it can be less if they're in network. It just depends on what that Medicare assignment is for the service they're going to see. And as a reminder, because they're going to Medicare approved providers, they cannot be balance billed or be subject to those type of excess charges. So let's move forward here. I just wanted to highlight our $0 plans and a couple of our other plans that sold throughout AEP. So as a reminder, we have the $0 HMO plan and we have a $0 PPO plan. The things that I really want to just point out to you are some of the benefits that are built into these products outside of the supplemental benefits that kind of make these plans attractive. First thing is that almost all of our plans, with the exception to one, does not have a medical deductible. So right away, we're giving the client first dollar coverage for their medical needs. And then on all of our products, we do not have a prescription drug deductible. So we're giving the client first dollar coverage for prescription drug needs. So right away, we're eliminating the barrier of deductibles, and we're giving the clients first dollar coverage for both medical and prescriptions. That can be a huge saving for your client right there. The other benefits that you'll want to take in consideration when you're looking at HAP is that we do have a very competitive out-of-pocket maximum. This is something you're going to want to pay attention to probably in 2021 with some of these other carriers. And the reason I'm bringing this to your attention is that starting next year, us as Medicare Advantage plans, we have to start covering people who have ESRD. So as you know right now on Medicare Advantage products, when you're doing the application, that is the one knockout question. So we can ask that question. If they answer yes, they're going to be denied, and we also verify it with CMS. So if they did say no and they truly have ESRD, they're going to get denied anyways. But starting next year, that's not going to be allowed to be asked, and so we are going to have to take ESRD patients. ESRD patients are very, very expensive, and we can't, as carriers, we're not allowed to differentiate or put separate cost share guidelines for people who are getting dialysis. So we can't say for dialysis, you're going to have a separate out-of-pocket maximum, you're going to have this separate coinsurance. CMS puts a cap on that of what we can charge for dialysis, or put what we can charge the member to have to pay for dialysis. And then obviously the out-of-pocket max is a number that is set by the CMS as well. But what you're going to see carriers start to do to try to manage this population and the cost that's going to be coming in with these people is the only way they're going to be able to do it is to increase the out-of-pocket maximum. So just keep an eye on that when you start looking at plans for 2021. And if you start to see carriers increase their out-of-pocket maximum, that's a good indicator of why they're doing it. But as it stands right now, we don't have any intentions of doing that for 2021, and we have very competitive out-of-pocket maximums for 2020 this year. Our inpatient hospital copays are very competitive as well. When you look at our primary care and specialty doctors, you can see those are competitive. ER and urgent care copays are pretty standard across the board with all carriers, but one thing I want to mention to you is that with HAP for ER and urgent care, when your client is utilizing those services, let's say they go to the ER because they might be having heart palpitations and the ER is trying to figure out what's wrong, so they're running CAT scans, EKGs, they might do an x-ray, they might do lab work. Anything that your client has done in the ER and urgent care setting with HAP is bundled, and it falls into that one copay. So they would either pay $90 if they're in the ER, or they would pay either $60 or $60 or $65, depending on the plan that they're in with us for urgent care. Labs are a $0 copay with HAP, so both preventative and diagnostic. So this is not just for your routine annual physical that it's a $0 copay, it's for diagnostic labs as well. It's not capitated where we're saying you have to go to Quest to get this. They can go to any lab provider that is in our network and have that $0 copay. PT, OT, ST, and mental health, we are the lowest in the industry for this. So you can see on our $0 HMO plan, it's a $10 copay. Typically when beneficiaries are having to have physical therapy, it's not a one-time use benefit, it's multiple visits. Some carriers are at $50, $60 a pop. If you have to use that benefit multiple times at $50 or $60 a visit, it can add up. We've kept ours lower strategically because we want our members who are in that phase of their care to be able to get that care so they're not getting readmitted into the hospital and costing us more money or the member more money in the back end. Other things to keep in mind when you look at prescription drug coverage, and I'll just go over that in the next slide, is that We do not have a drug deductible on any of our plans. The one thing I do want to mention to you is the second plan on here, which is called the HAP Primary Choice, Plan 024. You can see it's a narrow network option. This plan is a great fit for the right client because it has some very rich benefits built into it. But what you have to understand with that plan is that they must choose a primary care doctor within the United Physician Group, Oakland Southfield, IHA, or the Jackson Healthcare Network, and their referrals are required. So that is one of the plans that we offer where we do require referrals, and it's a narrow network primary care physician plan. What trips agents up the most on this product is because it's a HAP plan, agents automatically assume, okay, because it's HAP, Henry Ford doctors are going to take the plan. Yes, that's the case for almost all of our plans, but not this one. So this plan is specifically designed with specific primary care physician groups, and it does not include the Henry Ford Health System primary care physician providers. So just keep in mind that if you're selling this plan, it's a great plan for the right client, but they want to make sure that they find a primary care doctor that is in the network. And if they say they're seeing a Henry Ford doctor, it's not going to be a good fit for them for that product. So let's take a look as we move through here for the pharmacy savings. So for those of you that use Medicare.gov to quote your clients, you'll probably see that HAP falls towards the top of the list 9 out of 10 times for being the lowest cost for prescription drugs for your member. And there's several reasons why, because of things we have built into our products. So I'll start with just a couple. Is one, that we don't have the drug deductible. 2, we are offering preferred pharmacy pricing. So if your client goes to one of our preferred pharmacies, it reduces their copay by typically $5 or 5% if it's a coinsurance tier level. Reminder, preferred pharmacies, almost all of the national chains with the exception to Walgreens. So you're looking at CVS, Rite Aid, Costco, Meijer, Walmart, Costco, Sam's Club. If your client is using one of those pharmacies, it's going to reduce their copay. Walgreens is in our network as standard, just not preferred. The other thing we have built in is the $0 copay for mail order on Tier 1 and Tier 2 drugs for the 90-day supply. So as a reminder, our mail order vendor is Pharmacy Advantage. It's a pharmacy that is owned by the Henry Ford Health System. It's based out of Rochester Hills, Michigan, but it's a very well-known national type mail order pharmacy. So they're high customer service, very accredited. But as a reminder, we use Pharmacy Advantage. If your client is on any one of our plans and they're filling a Tier 1 or a Tier 2 drug and they do a 90-day supply, they would have a $0 copay if they're using Pharmacy Advantage. And then as a reminder, it would be a 0. And then once they get into the donut hole, it goes to the donut hole cost share, which is defined by CMS, and then it goes into the catastrophic phase after that. The other thing, too, you want to keep in mind is we have a very comprehensive formulary. So we do have some brand name drugs that fall in the Tier 2 generic category. I listed some here on this slide. Excuse me. Novolin, Novolog, Lantus, ProAir. So those 3 insulins and that inhaler, those are all brand name drugs. We classify them as a Tier 2. So if your client was on any one of our plans, they used the mail order and they did a 90-day supply through Pharmacy Advantage, they can get their insulin or their inhaler at a $0 copay. So right there, you can literally be putting hundreds, if not thousands of dollars back into your client's pocket every single year. So let's take a look at some additional supplemental benefits, and then we'll talk about Medigap products at a very, very high level, and then we can open it up to questions or close it out if we don't have questions. So as a reminder, supplemental benefits are becoming a very hot topic in the Medicare Advantage space. CMS has given us as health plans greater flexibility to build these things in. So here's what HAP is offering today for all of our members. We give them preventative dental built into their plan, provided through Delta Dental. I can't stress this enough because agents get confused. HAP only covers one cleaning, one x-ray, and one exam per year at 100%. We give our clients the option to buy a rider that will give them an additional cleaning and restorative coverage, but there's a premium that comes with the rider. But built into their plan, they get one cleaning, one x-ray, and one exam covered at 100% through Delta Dental. With Delta Dental, they have the option to use the Premier Network or the PPO network through Delta Dental. For vision, we use our own vision providers. So you would search hap.org to determine who they can go to for their vision benefits. It's a $0 eye exam, and we're giving the client $100 a year for lenses, contacts, frames, and so forth. For hearing, we use Nation's Hearing. The clients have a flat dollar copay for hearing aids. We will cover one hearing aid per ear per year for our members. The copays can range anywhere between $689 and go up to just over $2,000 per hearing aid. Now, I know those copays seem high, but for anybody that knows someone who's had to buy a hearing aid cash out of pocket, you would know that hearing aids are very expensive, and at those copays, they're actually getting a significant savings. Also built into the vision or the hearing benefit is a $0 exam, 3-year supply of batteries, 3-year manufacturer warranty, and a one-time replacement for lost, stolen, or damaged hearing aids. Over the counter, so this is a benefit that's built into all of our plans. It is a use it or lose it benefit. It's provided through Convey Health. The amount that we give our members ranges, so it can be anywhere between $45 to $100 per quarter. They can order over the phone, online, or through the mail. So when the member enrolls, they're going to get a catalog in the mail, and they can order those ways through the catalog. So they can fill out the form that's in the catalog and send it in. They can call the number in the catalog, or they can go online and fill it out that way and order that way. This is a great tool for you as agents to use to be able to reach out to your clients mid-year. So as a reminder, it's a use or lose it benefit. We're now at the end of the first quarter. So starting in April, it's a great way to call your clients, see how things are going, and say, oh, by the way, you're now in a new quarter for your over-the-counter benefit. Don't forget to use that sometime between April, May, or June. So it's just a good touch point. It's a good value add that you're bringing to the table for your client. It creates it to be a little bit stickier of a relationship. So it's a great thing to use for retention purposes. And as you know, it's a long list of items that your client can order from. I do want to stress that because of COVID-19, you are seeing some of the items on back order. As you can imagine, the hand sanitizers, the face masks, the gloves, those type of things that they typically can get through the over-the-counter benefit, you are seeing a back order of those because of the high demand. So let's move through for additional supplement benefits that are also built in. Telemedicine, this is huge right now, especially with COVID-19. People aren't wanting to leave their house, but they might have minor conditions that they'd love to see a doctor for, but they're afraid to go to urgent care or maybe to an ER setting or maybe to their primary care. We use MedNow for this benefit, or we use Amwell for this benefit, and it follows the primary care physician copay. There is no limits to the amount of times that your client can use this. And with this, they would be seeing a doctor virtually from their smartphone, tablet, or computer, and these doctors can write prescriptions. If they have that provider send the prescription to Pharmacy Advantage, right now Pharmacy Advantage is offering a free delivery for all of our members. So they can have the prescription delivered directly to their home at no cost, outside of the cost of the copay for the prescription. Moving through to the visitor traveler benefit, we talked about that at a very high level, but I'll recap it quickly. It's for our HMO members only. This is where our members that are in the HMO plan that are traveling to Florida, Arizona, or Texas can use their coverage for routine care and pay the in-network cost share. Assist America is built in at no cost to our members. That gives them travel assistance in an emergency situation. So it's not going to pay for deductibles or copays or coinsurance. What it's going to do is it's going to help cover cost of medical transportation. It will help with translation of medical records, lost prescriptions, lost luggage. There is a long laundry of list of things that they will help with in an emergency type situation. Silver and Fit is built into all of our plans at no cost. HAP is the only carrier left in Michigan still using Silver and Fit. The nice thing about Silver and Fit is that it does include lifetime fitness. And then as a reminder, this is another thing that you might want to be able to reach out to your clients on, is as we know, fitnesses and gym facilities are closed due to the epidemic. The Silver and Fit does offer the home fitness program. So if those people want to offer order a home fitness kit due to the inconvenience of not being able to go to the gym right now, they have the option to do that as well. So let's take a look at the buy-up dental package, then we'll take a look at MedSup, and then we should be at the end of the webinar here. So for the buy-up dental, very quickly, it's powered through Delta Dental. It is only available for our Medicare Advantage members. You cannot sell it to Medicare supplement clients, and you cannot sell it standalone. There are no waiting periods for any of the services, and it has coverage for major Class 3 services such as implants, bridges, and dentures. There's two options. There's one that's $21.39 a month and one that's $41.26 a month. Very similar in coverage. You're just looking at a little bit difference in coinsurance amount, and then the annual maximum. One has $800 max amount, the other one has $1,500. As a reminder, your client can add this on at the point of sale by checking a box on the application, or they have the ability to add it within 30 days of the effective date of their enrollment into a Medicare Advantage plan. After that, if they have not added it on, they must wait till the next annual election period. Members can drop the dental benefit at any time. Let's take a look at a high level for Medigap. So as a reminder, with Medigap, HAP offers plans A, C, D, F, G, and N. Our rates are going to be determined by gender, smoker status, the attained age, and then obviously if they're going through underwriting, then they would be looking at medical claims and medical utilization and so forth to determine if we would approve them, and then what rate they would be approved at. So if a client is not guaranteed issue and they're going through underwriting, we do offer the preferred rate. We also have a non-preferred rate, and then we also have the ability to decline them if we do not think they're insurable. As a reminder, if somebody is turning 65 and they're new to Medicare, or somebody is new to Part B, they do get guaranteed issue into any one of our products. The one thing I can't stress enough is the people that you run into that have worked past the age of 65, they've already been on Part A and Part B, and they retire. Yes, they get a guaranteed issue into Medigap. With HAP, we will only allow them into GI into plans C, D, and F, and they can only get C or F if they aged into Medicare prior to January 1st of 2020. So most people, Plan D is pretty much going to be the only option in this situation if they're enrolling into HAP. Plan D, for those that are not familiar, is identical to G. The only difference is that Plan D does not cover the Part B excess charges, where Plan G does. Also, as a reminder for household discount, that is new for this year, but we provide a $10 per member per month discount if there are two people in the same household that have a Medicare supplement plan with HAP. So as a reminder, it would be two people within the same household that have a MedSup. So it can't be one on Med Advantage and one on Medigap. They both have to be on a MedSup. Moving through to our rates, this is a very high-level overview. I would say our rates are pretty competitive across the state. Looking and doing an analysis, I think our biggest competitor is probably going to be United Healthcare. But as a reminder, when they're buying HAP, they're buying local. They're dealing with people here in Michigan and a Michigan company. You can sell our Medigap plans across the entire state. The other thing I want to point out too is that if your client does buy a HAP Medigap policy and they permanently move outside of Michigan, we will allow them to keep the plan. They can keep it as long as they continue to pay the premium, and there is no change to their rate based on moving outside of our service area. With that being said, that is the end of the webinar. Christy, I don't know if we got any questions, but I do want to remind you that we're all in this together. We want to thank you for being patient with HAP as we transition all of our staff to work from home at this time. But we are still accepting enrollments. We are still processing applications. I know it's not the easiest thing to do for agents due to CMS guidelines, But we did record a webinar with IAD on our electronic telephonic enrollment process. So Christy would be glad to share that with you if you have questions on how HAP can assist you with that. But what I'm seeing out there with agents to help them kind of just grow their business or stay in front of their clients is using those supplemental benefits to remind their members to use them. I'm seeing agents reaching out to their clients and asking them or reminding them about hospital indemnity plans. So with COVID-19, you're seeing a lot of inpatient hospital admissions. So some people are nervous about that. They might be interested in buying an indemnity type policy to help offset that inpatient hospital copay. So that's a good strategy to use right now. But there are things that you can be doing in this time to really strategize or to help yourself kind of grow business. Ourselves here at HAP would be glad to work with you, and I'm sure IAD as well as your FMO channel would be able to assist you in some of those strategies as well. But at this time, I want to thank you, and I'll turn it back over to Christy unless we have any additional questions.
Thanks so much, Kevin. I appreciate it. I do have one quick question, and that is, can you address how observation fees are billed in with regard to any of the HAP plans?
Yes. So with observation, it's essentially considered outpatient. I mean, that is what it's coded and classified as. However, there are carriers that kind of handle that code when it comes in differently. We treat it as outpatient, so the member does have the outpatient hospital copay when they're in an observation status. So,
okay, so it would be that $250 a day or whatever, that type of that type of fee.
Yes, but it's not a day. It's only a one-time copay. So it would be the $200 or $250, whatever the plan has for outpatient hospital copay. That's what would be billed, and they would pay that one time for the length of time that they're in there. And then you have to keep in mind is keep in mind is they are considered outpatient. So the difference between inpatient and outpatient is when they're outpatient, it's not considered bundled. So they're going to have their outpatient hospital copay. They might have a lab copay, an EKG. So you can see where they might get hit with multiple copays in an observation status setting versus inpatient where it's all bundled in one copay.
Okay, that makes sense. And that's where you mentioned offering a hospital indemnity type of plan. I can tell you there's Life Secure and GTL and Medico, and they have observation baked into their plan, so you don't have to buy a rider. That's where that becomes really attractive because that does give those dollars back to that policyholder, so that will help fray those costs. So that's a thank you for making that suggestion, Kevin.
No, absolutely.
And I think I am not seeing any questions, so we appreciate your time today. And Kevin, we appreciate you being able to provide us this information. It was very informative. It seems like I always learn one or two additional things. So thank you so much. And with that, I will let everybody have the rest of their day back.
Awesome. Thank you. Everybody have a great day.
Okay. Bye.